Hi, welcome to Capital Health Network and our winter survival webinar. I'm Jill O'Donnell from the Quality Improvement Team at CHN. Thanks for taking the time to attend tonight's webinar to cover a topic which we know affects all of primary care, how to best manage through winter. This webinar has been put together in response to our winter planning survey, which went out to all practices in March this year. The topic reminds us of how the seasonal nature of healthcare and the need to be proactive to survive the challenges that winter brings us in Canberra. I wish to acknowledge the Ngunnawal people as the traditional custodians of the land which we are meeting. I wish to acknowledge and respect their continuing culture and contribution they make to the life of this region. I would also like to acknowledge and welcome other Aboriginal and Torres Strait Islander people who may be attending tonight's event. We're recording the webinar tonight, and it will be made available in a few days' time to people who couldn't attend. All participants have been muted. Please address any questions to the panelists in the Q&A section in the Zoom window, and we'll endeavour to answer those questions in the Q&A session at the end of the presentations. So to introduce tonight, we're joined by Dr. Victoria Mansell, a public health research registrar at ACT Health and a GP. Amy Bowen, who's a North Canberra General Practice Manager and Area Manager with Partnered Health. And we have Dr. Louise Kenyon, who's Clinical Lead and Health of the Health Pathways Programme and a GP, at the Health Pathways Programme at CHN, and she's also a GP at Warramanga Medical Centre. We will cover a public health update this evening, initially, and where we are now and how we anticipate the winter season will play out. And we'll then have a look at the 3 Ps of managing your practice throughout winter, followed by a discussion of the alternative pathways and options to consider for your patients beyond the general practice. Before this, we'll just have a quick just have a quick update of some CHN activities. The Strengthening Medicare grants, first of all, the applications are closing on Thursday this week for these grants. There are only a few practices left in the ACT who haven't applied, and approval and payment for these is being made. It's about a 2-week turnaround. So there's only a few practices left that haven't applied for that. CHN is working in partnership with APNA to offer the Transition to Practice Programme, or TPP, to nurses who are new or transitioning to primary care. This is an 8-month evidence-based supportive programme which includes mentoring, and applications are now open for the July intake. Also, the QI team have developed 3 quick step resources. These are for new practice managers, practice nurses, and for admin team staff. They're available on our website, or you can get in touch with us to have a look at them. And also, Provider Connect Australia is operated by the Australian Digital Health Agency, and once registered allows healthcare provider organisations to update information about their healthcare services and the practitioners in one place. One update in Provider Connect Australia will automatically send updates to nominated hospitals, pathology, radiology services, public service directories, secure messaging providers, and more. For further information on registering, this is available on our website. It's worthwhile having a look. So first of all, I'd like to introduce our first speaker, Dr. Victoria Mansell. She's a public health registrar and a GP, having completed her general practice training in the ACT. She's currently working in the office of the Chief Health Officer at ACT Health. She's previously worked as a medical advisor to the Chief Medical Officer Group at the Australian Government Department of Health and Aged Care and at the Therapeutic Goods Administration. Thanks, Victoria.
Thanks, Jill. I'll just bring up my slides. Okay. Now, can you see my slides? Excellent, thank you. So thanks for inviting me to present at this winter survival webinar. So tonight I'll focus on where you can find current COVID, influenza and RSV epidemiological information for the ACT, ACT Health key winter messages for the ACT community regarding acute respiratory illness, and current information about respiratory testing in the ACT. So ACT Health provides regular updates on respiratory infections in the ACT. In particular, we publish a weekly report that's updated every Friday and contains data on COVID, influenza and RSV cases in the ACT. And this is available on our COVID-19 website. This graph is from that weekly EPI report, and that's published on our website. And it shows the number of COVID cases that have been reported to ACT Health in 2023. You'll see that after 11 weeks or thereabouts of increasing COVID cases, the case numbers now appear to have stabilised. This pattern of cases is what we were expecting leading into winter, and is similar to the pattern of COVID cases being reported in other states and territories around Australia. Severity indicators, including hospitalisations, ICU admissions, and outbreaks in key settings such as aged care facilities, are monitored and reported on our website. And so far this year, there have been no signals of concerning increase in severity of cases seen. This graph shows the number of influenza cases that have been reported to the ACT in each year since 2018. So 2023, which is represented by the red line, so far this year, we've seen an increase in influenza cases, particularly over the past few weeks. And that seems to be on a similar trajectory, both to 2022, which is represented by the yellow line, and 2019, which is represented by the grey line. So this is consistent with us moving into the influenza season. And again, a similar picture is being seen in other states and territories around Australia. However, we need to be cautious in interpreting these numbers due to the changed testing behaviours since before the COVID-19 pandemic. This figure shows the number of cases of RSV reported in the ACT in 2022 and 2023. So RSV has been a notifiable condition in the ACT since February 2022, and we started reporting on it in our public EPI report just a few weeks ago. So the number of RSV cases being reported to ACT Health is also rising, and this is mostly in children aged under 5 years. Looking at COVID vaccination rates, this table shows the proportion of estimated eligible residents of aged care facilities who've been vaccinated with the 2023 booster dose. The ACT looks like it's tracking well compared to other states and territories, with around 62% of eligible residents vaccinated. However, it's difficult to estimate the number of eligible residents due to eligibility for the booster dose being linked with the time since last vaccination or last infection with COVID. So, as I'm sure you're aware, the Commonwealth no longer has in-reach programs for COVID vaccination in aged care facilities. So if you or your practice provide care to residents in aged care facilities, we encourage you to check what the arrangements for the facility is making in relation to both COVID and influenza vaccinations. This table I took from the National Centre for Immunisation Research and Surveillance website, and it shows influenza vaccine coverage by age group and jurisdiction. As in previous years, the ACT is near the top. ACT is near the top in most age groups compared to other states and territories. Again, we'd like to encourage you to please continue to help facilitate your patients who are at higher risk of severe disease, including your patients in aged care facilities, to get their 2023 COVID booster dose, and if they're eligible, and their influenza vaccination. ACT Health is continuing to work to increase awareness within the community of people's individual risk factors for disease. So we're particularly encouraging people at higher risk of severe disease from COVID and influenza to speak to their healthcare team before they become unwell, so that they can plan how they'll best access appropriate testing and treatment options. We're also encouraging the community to continue COVID smart behaviours, including wearing a face mask, practicing good hand and respiratory hygiene, staying home and taking a test if they're unwell. And so this information and others can be found on the ACT Health website. I've got some links there on the slides. The ACT Health continues to encourage all people with acute respiratory symptoms to test for COVID. So for most people, a rapid antigen test is the most appropriate test for COVID. They're quick and easy to get to diagnose with COVID. However, PCR testing may be particularly useful for symptomatic people who are at higher risk of severe illness, who test negative with a RAT, and who may benefit from oral antiviral medication. PCR testing continues to be available with the pathology request form. However, concession card holders may access PCR testing without a pathology request form from certain participating pathology providers, and the location of these providers can be found on the ACT Health website. We encourage you to have a conversation with your patients at high risk of severe disease before they become unwell with respiratory illness. Things that you could discuss include whether they know that they're at higher risk, whether they're eligible for antiviral medications, do they know what they should do if they develop acute respiratory illness, and do they know what their testing and treatment options are. Please encourage, again, to continue to encourage and facilitate your patients to get their recommended COVID and influenza vaccinations. So helpful information and guidance tools can be found on the ACT Health COVID website, which include an antiviral pre-assessment form that can be used to help facilitate early access to antiviral medication for your eligible aged care patients. This is not mandatory, rather it's provided to assist you. Other useful guidance that can be found on our website include COVID exposure risk assessment guidance and return to work guidance. Again, these are not mandatory. They're designed to help you assess risk in your workplace, make decisions and support your workforce. So we've recently updated this guidance to recognise that most interactions will be lower risk for transmitting COVID. Risk of transmission depends on the length of time exposed, distance between cases and the contact, and the environment, such as well-ventilated outdoor areas versus a small, poorly ventilated room, and also personal protective equipment that's worn by both the case and the contact. More information regarding COVID exposures, options for people who test positive for COVID, and returning to work after having COVID can also be found on our website. And finally, the ACT Health website also contains links to resources for other diseases other than COVID and respiratory infections, and I encourage you to check it out. Thank you.
Sorry, mine was freezing for a second. I'll just share my screen. Okay, so this evening I'll be talking about products, process, and patient. And we'll just work through. Just bear in mind, though, that it's very different depending on the size of your practice, how many doctors you have, how many patients you have coming through your door, where you're located, you know, the needs and wants of your nurses and doctors and receptionists as well. So just keep that one in mind while we're going through these. A few things that have popped up in regards to products. So PPE, so during that COVID, I guess that lockdown period, we were supplied free PPE, which was very generous. However, we're kind of shifting off that. So it's bearing in mind who you can get that through. So we do have, you know, the local Capital Medical Supplies, not so local places like Team Medical. It's just working out, you know, what's quickest for you and what's best for you and how you can order them. A lot of people have their own, you know, order online tools available, especially if you are in the corporate area. So it is a lot easier in that respect. But other than that, also call around. If you have a practice nearby and you're short on masks, I'm sure you can help each other out here and there. We've had to do it a few times. Vaccination supplies, probably wouldn't recommend sharing those due to cold chain issues. However, do contact ACT Health. If you are providing COVID vaccines, you do have that weekly cutoff. So just making sure that you get there in time. If you can't, they are pretty good. If you do call up, they might be able to squeeze a delivery in. Yeah, ACT Health are great turnaround. So if you're ordering any of your vaccinations, your flu vaccines, the turnaround this year in particular, we've noticed is very quick. It's only a few days. And just call them if you get stuck. Emergency meds, so spacers, nebulizers, tubing. Once again, it's similar to PPE, making sure that you do have a good supplier. And you can actually get a few things from medical reps, which not many people are aware of, nebulizers in particular. So if you have any medical reps coming through, speak to them, because they are always willing to bring things through the practice. And that way you can give them a go as well, and doctors can work out what they like and don't like. And cleaning. So cleaning post-appointment, I think is a pretty big one. It does come pretty standard these days to do with our accreditation standards. So just making sure you do have an actual cleaning schedule that is checked. You've got your daily, weekly, monthly, or quarterly for some things, but just making sure that everyone is aware of their daily checklist for cleaning, and that they're ticking those things off. So you can actually get that off, you know, sites like RSCGP and whatnot, or obviously make your own, just making sure though they are with those standards of what needs to actually be cleaned and on what timely basis. So we'll move into process. So use your data to understand current and potential demand. So this comes down to our Cat 4, or, you know, what medical software you're actually using. A lot of people, I think, are on best practice. So that also includes Cubico. If you're not sure, we've got a lot of new faces around, not just Canberra, but around Australia, really, in healthcare. So a lot of new nursing staff, a lot of new practice managers and reception staff. So they're probably not quite sure how to get this data. So call your local PHN, call Capital Health Network. They can even come out to you and help you, show you how to run those reports through CAT. And then you can sit down with your staff, your nurses from there, and doctors as well, and decide what you actually, you know, what are you trying to pull? What are you trying to understand from your patient demand in your practice? So we've got schedule activities to allow on the day acute care. So making sure that, you know, you may need on the day appointments, and also taking those on the day appointments off. If you utilize HotDoc or any online booking system, so they can't be booked online, the patients have to call up, and that way you can actually triage them depending, because they might, to them it might be really, you know, quite urgent, but it could be something that could wait an extra day or two, and you're actually using that on the day appointment for someone who really does need it on that day. And in that, it's being able to triage properly. So a big thing which Jill did speak about earlier was the quick steps documents. Just making sure your admin staff do use those. So they're little training modules, really helpful. And in there is a piece on triage and how to decide where a patient, whether they need to come in straight away or something can wait a day or two. And discussions with GP staff, as well as probably nurses, scheduling CDM spots during those non-peak times. So obviously we're in the middle of flu season. So first and foremost, we're wanting to get all our flu shots done. So I guess CDM, because of COVID, it has taken a big step back. So we still do need to focus on CDM, but it's, you know, if you know you're quiet on a Wednesday, scheduling a full day CDM on a Wednesday, those kinds of things, and working with your doctors and nurses for them to understand and know when they can and can't schedule those things is really important as well, because obviously at the end of the day, that it is the you know, the patients that we need to look after, and the doctors need to be seeing those patients on a regular basis and not just ad hoc because we couldn't get them through the door. And telehealth blocks and versus face-to-face. So telehealth has definitely boomed in the last few years. So it's working out what's best for your practice and for your doctors. So each doctor is very different in what they like and don't like. Some don't like telehealth at all, which is understandable, because face-to-face is a lot more beneficial. However, telehealth does have its benefits. So if someone is just genuinely too sick to come in, it's working out with your GPs on an individual basis, whether they're happy to do a few appointments, maybe through their lunch break or at the end of their day or at specific times throughout their week. But just keeping in mind that Medicare, the 20/30 rule, that one's a big one. So with the waiting room setup and scheduling, so scheduling special clinics, so depending on the size of the clinic, once again, baby immunizations, you know, respiratory or elderly patients, it's similar to a flu clinic. So are you setting up flu clinics already? Personally, for my centre this year, we actually didn't do a flu clinic for the first time in about 4 or 5 years. And it worked really well, surprisingly. I think also just because the flu season hit us so quickly, so hard and fast. But just bearing in mind, obviously mums don't want to be sitting around with their babies for too long waiting, you know, for a vaccine when they're not actually sick. So just, you know, in smaller clinics, it may be, you know, we do vaccine, you know, babies from 9 a.m. to 11 a.m. and then the elderly patients after that. It's completely up to you, but that's something I would definitely look at speaking about as a whole clinic, because it needs to be a really, it needs to flow quite well. So reception need to understand what their role is to be able to book them in correctly, and then take them down to the nurses and the doctors as well. COVID safe distancing and seating and signage. So I think this one's a really important one. Ensuring that patients do feel safe. So if it means keeping those chairs still that, you know, 1 meter apart, having that signage around, it does relax things once patients are actually in the clinic to see that you're still taking things seriously, because it's not just COVID that's going around. You know, RSV, there are so many logies going around at the moment. So to even just have that small bit of distancing when someone's coughing, it does make you feel a lot better. And signage as well. It's always handy to have a sign on that front door. If you're experiencing any symptoms whatsoever, please wear a mask. It is a little bit hard and quite costly that you keep providing masks. So if you know, your practice can't keep providing masks to patients, which we definitely can't. If they've forgotten that one time, that's fine. We'll give them a mask, but we'll just let them know that next time they will need to bring their own mask in, especially if they are presenting with any symptoms that could be unsafe to the rest of the waiting area. And that comes under consider universal mask wearing. So while we really want to encourage our patients to come in and feel safe, it's a bit of a 50-50 one. It's definitely beneficial. The stats are out there. So definitely, if you can promote wearing masks, go ahead. We did find in a few of our clinics, though, where we chose to relax a little bit, our patients also did relax. So it's knowing your patients, knowing if you work in a practice that is more of an elderly age base, of course it's a no-brainer. Everyone should be wearing masks. If it's a bit of a mixture, you know, that's where you'd look into scheduling special clinics, and you would be looking at wearing masks for certain periods of the day, you know, for your respiratory patients and whatnot. And I think that one also comes down to the clinic as a whole. That's where you'd be deciding with everyone as a whole what you would like to do, because everyone needs to be on the same page when it comes to mask wearing in your clinic. And practice policies for babies with respiratory symptoms. So just making sure that triaging again is a really big one. And under this category, nursing as well. Nurses, they're just so busy, but we've got a lot of new nursing staff across the board. So it's making sure that they're also comfortable with triaging, because a lot of the time reception will actually put calls through to nurses when it's kind of past what they can handle. And that's where nurses do need to know, you know, what they can and can't do, or how to actually triage those babies, whether they need to come in or whether they potentially need to go to hospital, rather than, you know, bothering the doctor every few calls. And that's I think a really big one that yeah, stops with our nurses as well. So triaging, like I mentioned in the quick steps, so a great useful tool that Jill spoke about. You can find it on the CHN website, and I think Jill said that she'll shoot the link up after this for everyone, or send it around. And alternative pathways to recommend if there are no appointments. So I think that will be touched on towards the end, not by myself. So workforce illness planning and communication. So ensure contacts are up to date, staff and patients. So ensuring that you know who to contact for what. You might find handy, which we've actually found very handy, especially for admin, is a little who to for what. So ensure you've got contacts for all staff, you know, making sure that ACT Health is on there, PHN is on there, just the usual vaccines, a little checklist, because you know, with a lot of new faces, people aren't sure, and they don't really ask until it's either, you know, not necessarily too late, but until things are getting quite tight. And you know, by the time you actually need to order something, it's, you know, you're then having to put patients off, and that's, you know, they obviously don't appreciate being called and being put off to see their GP, because, you know, we don't have certain things in stock or can't accommodate to what's needed. So all staff understand the process for communicating. So it starts from reception all the way through to the end. So as soon as a patient comes in, they know that path of communication, as well as, I think, with a lot of new faces, people really aren't sure who to go to. So having a flow chart in your practice of, you know, who the practice manager is, who each doctor is. If you're in a corporate, having that flow chart of, you know, who to go to for HR, for nursing issues, things like that. And then that comes under who it's allocated to for that responsibility. So, you know, you go to your practice manager for this, you'll go to your head clinical nurse coordinator for this, or your head doctor if you have one for this, as well as keeping in mind work health safety. You know, if there's a 2IC, are they what's their role? Are they part of the WHS? Because at the end of the day, we still need to keep our staff safe. And so postponing high risk procedures. So Spiro, for example, so there was quite a hold on Spiro throughout the last few years. Now it comes down to the practice and what the practice does prefer. So it's a bit of an iffy one, but just bearing in mind, if you are providing Spiro, it is recommended that there is some form of a window or airflow coming into the facility, and that people are wearing appropriate PPE. That's a really big one, and any patient coming in for that really should be having no symptoms whatsoever, no cold or flu-like symptoms, and potentially, if comfortable, the practice can ask them to provide a negative RAT test as well. So telehealth options for patients. So as discussed a little bit earlier, they can help, you can pop that online as well. So you can actually schedule your doctors to have specific times throughout their days, if they're comfortable with that, to schedule telehealth online. Otherwise, you can keep that offline, and you can ask patients to call up, and that way you can actually triage whether a telehealth option is best for them, or if they are best to come into the practice and see their regular GP. So medications, so e-scripts, home delivery of medications, those things, I guess with today's day and age, close to everyone should have access or to actually provide an e-script. Especially over the last 12 months, it's really taken off and it's really handy. I think a lot of people still get quite confused about how an e-script actually works. I know a few of my doctors at times and patients come in and they're a little bit unsure how it works. So an e-script, you can actually either get it sent to your phone or an email address. So we've actually found with the elderly patients, they much prefer an email because they don't trust the SMS, which is definitely understandable. But yeah, with the younger ones, we're finding that e-scripts, they're loving it on their phone, and they'll just walk in and scan the barcode at their local chemist and then go from there. And home delivery of medications as well. It's all about working closely with your local pharmacies and talking with them. So I know we're all very busy, but it's taking that time out just to shoot across the street if you've got some local pharmacies, or picking up the phone, giving them a call, and just helping understand how it works for them and how you can make it work for you and your practice. Because I'm sure you can run a few reports on elderly and get your doctors to have a look of who they think actually might benefit from something like that. Email, so emailing of sick certificates. So while email is great, it's accreditation standards, it's actually not ideal. There are a lot of risks that come from emailing anything to do with a patient, whether it be just a medical certificate or results. It is high risk. So while that it's up to each individual practice, it is something that I would be quite strict with, and you can always respond, because we've noticed we will send a patient their sick certificate and then they'll email back asking for another appointment in a month's time, and then a few other things on top of that as well. So it's kind of pushing back to say, here's your certificate. If there is anything more, please phone the practice, because we don't want to miss anything. It's just too high risk. And just ensuring that people who are emailing anything, I don't think it should be a free rein for everyone to have access to that email. It should just be a one or two, so the practice manager and maybe a 2IC or a senior medical receptionist who can send certain things like sick certificates to patients. as well. And on that, anything that is being emailed, if you're unsure, even if it's a third party, I would always call the patient just to ensure that they are comfortable and that they're aware that that's coming through. So health literacy resources, so home monitoring and when to escalate care. So coming down to that is triaging again and speaking with your doctors, and that comes into sick day plans for vulnerable patients as well. So making sure, you know, do you know who's eligible for antivirals? You can actually run that, run those reports. If you're unsure, contact CHN, and they'll definitely be able to help you. Run some lists out for your doctors. Get them to highlight patients that they think, you know, might be at high risk, and that need monitoring, and that at times they may need their care escalated, and what processes and procedures you'll follow. And I think that also stops with reception as well, because they are getting a high volume of calls. If they've got a few names that ring a bell or that they can see are priority, they can then escalate that care straight away to their doctor, and their doctor can then take control from there, or with the nurses as well. If, you know, doctors are, and they're absolutely run off their feet at the moment. It's out of control. So it's having that, okay, I've noticed this patient has caught up. They're on our high category list. Take it to the nurses. What do you think? And the nurses can take it from there, call the patient, see how they're going. Yep, I think you need to, you know, I'll get the doctor to call you a telehealth, you're too sick to come in, and kind of follow it along those lines. And that does kind of fall into the sick day plans for vulnerable patients. So those patients, if they're too sick to go to work or whatever the case may be, they need to know what they can do. So it's, do they call their practice and they're automatically, you know, okay to be booked in for a telehealth, or they can just be booked in at any time with their doctor when that doctor is actually working that day. So it's making sure that patients know what to do, and maybe bringing those patients in or calling them to say, listen, we've identified you in this category. You know, let us know when you call. Just say you're part of that vulnerable patients group for our practice, and this is I've been told I can call, and getting with my GP, and to have regular meetings about those patients. So making sure that everyone from reception, nursing to doctors, they know that list, and they know what to do for that list. And relevant vaccinations administered early. So nursing, ensuring nurses as well. So nurses actually have access to the Quick Steps document, and there are modules in there for nurses as well. And ACT Health, so vaccination line, they are amazing. They will answer all questions. Anything that they have, you can contact them, or you can even, you know, if you're lucky enough to have a senior nurse, get them to write down the schedules and the numbers of who to call and whatnot. There's a lot of guidance and help. I think some people just get stuck on who to go to for what, especially seeing a lot of new faces, especially a lot of new nursing faces across the board. It's trying to have that senior nurse who can then guide from there. And if you get stuck as well, if you've got a good relationship with another clinic, give them a call and work together to help each other out if you get stuck on who to contact for what. And ASAP appointments, again, book on the day. So trying to ensure that you've got on the day appointments for those patients that actually really need those appointments, and it comes down to triaging as well. It also, a big one, it comes down to the doctor and what their preferences are, because, you know, some doctors don't mind squeezing in, but it's a lot on them at the moment. So actually being able to schedule their day a lot neater for them and manageable. So they're actually able to take time with their patients rather than just, punching through them where the doctor's not feeling that they're giving their patients their best care. And that's it. Thank you.
Thanks very much, Amy. And I have to apologise that I didn't introduce you fast enough at the beginning. I'll just give the intro to Amy first of all before we go on to Dr. Louise Kenyon. Amy Bowen's the North Canberra practice. She's a practice manager and area manager with, North Canberra practice, and she's area manager with Partnered Health. After her schooling, Amy moved into an admin role for a local GP clinic. From there, Amy became a practice manager at 18 and has been in the industry ever since, which is very impressive. Amy's currently ACT manager for Partnered Health. She oversees 4 practices, including her own. It's a role and company she absolutely adores, being at North Canberra Family Practice and Partnered Health for the last 14 years, including a 3-year interstate stint where she was in an operations accounting role. So thanks very much, Amy. And next, we're going to move on to Dr. Louise Kenyon. Dr. Kenyon is the GP clinical lead of the Health Pathways program at CHN, and she's the GP at the Warramanga Medical Centre. Thanks, Louise.
Thanks, Jill. Hi, everyone. I'm going to show you a little bit about Health Pathways. I think our audience is mainly practice managers, so I've done it as an introductory guide. If you are an experienced Health Pathway user, there might not be very much new in this webinar for you. So first of all, to get to Health Pathways, you can either just Google Health Pathways ACT without a space in the Health Pathways, or you can use the login ACT Southern New South Wales communityhealthpathways.org. It is password protected. It's not a consumer site, it's a clinical site. So please don't give out these contact details. The username is together and the password is for health. So I'm going to show you, this is the page you land on. And there are 2 different ways of finding what you want. You can see a green arrow there, which is the search bar, or you can use the table of contents, which is down the left-hand side. So in terms of, I was asked to talk about who to send or where to send people when you guys aren't available. We have a page called After Hours Providers. If you go to, you can put that in the search term and it will take you to this page. There's a combination of different things on Health Pathways. We try and balance information on the page with and external links. We want you to be able to find what you want without too much scrolling. So we have a combination of drop boxes. You can see I've put a green arrow next to contact the service. When you click on that, it will open up to show you more information. Right below that, you can see the National Health Services directory, and that's got a box with an arrow out. That goes to the National Health Service directory. Victoria mentioned that in her presentation. I think it's a good idea to put your practice on that, especially if you are open on the weekends. That will help direct people to your practice. The directory is also something you can use if you want to direct people away from your practice. I think that's the real benefit of having day of appointments, is it keeps people at your practice. But definitely use the National Health Service directory if you want to direct people away from your practice. It gives all the private home calls, the telehealth and physical practices that are open after hours. So going forward, this is what happens if you click on that contact the service box. What it does is opens up different services, and you can click on each of those grey boxes. You can see they've got a down arrow. What I've clicked on is the Calm South side, and it gives you their contact number, their details, their hours of operation, and how you access it. If you click on the Community Health Pathways logo, which is at the top of every page, what it does is takes you back to the home page. So what I've marked here is we're going to go through using the table of contents. So we've got COVID-19 bookmarked right at the top there. You click on that down arrow, what you get is a list of all our COVID-19 pathways. These are mostly clinical pathways. Each of those gives you, well, what it says. I might note from Victoria's presentation, the COVID-19 medications pathway has that pre-assessment form on it for your vulnerable patients. So you can set them up before they've got COVID. I'm going to look now at the COVID-19 referrals page. Oops, no, I'm not. I'm going to look now at the COVID-19 management page. I wanted to particularly point out this section about testing for COVID-19. Victoria covered this a little, but it's really hard to remember. And what this does is tells you where you can get free tests. So remembering this website covers Southern New South Wales, which is why you see New South Wales and ACT links. Tells you where you can get your free RAT tests, who should have a PCR, and then how to get the PCRs. Victoria linked to the ACT COVID testing sites, which is that second green arrow there, which takes you to the ACT Health website. I've also gone down further on that page. This is an excerpt from, again, the COVID-19 management page. And we give you some hints for where to seek advice. So when you're seeing a patient, they've got COVID, you're going through, you've prescribed their antivirals and you're making sure they know when to get help. And then we've got the links down here that after hours general practitioner goes to the National Health Services Directory, goes to that after hours providers page. The local hospital-led COVID-19 service. I know that's a bit of a mouthful and we all know that's care at home in the ACT. Again, that's covering Southern New South Wales. We've also got the National Coronavirus Helpline and Health Direct, which are numbers that you can give to patients. They're both available 24/7. And if a patient needs some advice after hours, they're good numbers to be able to give them. So going to the local hospital-led COVID-19 service, this takes us to the COVID-19 referral page. So you can go directly to this page from the main index, from the search, or from the pathway. So then we've got that weird hospital-led outpatient COVID service, but you can also see that we have different categories that you might want to refer a COVID-19 person to. So the COVID testing, again, links to the ACT Health website. Antiviral dispensing service. That's a bit of a funny one because Southern New South Wales does still have them through the hospitals. For the ACT, what it links to is the Guild Find a Pharmacy service. Anyway, I'm going to open up the hospital-led outpatient service. And what you can see there is we've got both the care at home program and the walk-in centre. Each of those grey boxes open to give you more information. So here we have the information about the COVID care at home program. These numbers are so the nursing team is the number you can give out to patients, but the nursing team leader is the number that GPs can call if they want more information. Then we have information about the service there. If you see anything at all on a health pathway page that is incorrect or missing, please use the send feedback button in the bottom right-hand corner of the page. That sends us an email and it helps us prioritize what we need to update through the website. Again, you can get to Health Pathways from Health Pathways ACT. That is the web address. The username is together, the password is for health. Thank you for your time, everyone.
Thank you very much, Louise.
You're welcome.
I'm just trying to share my screen again. Thank you, Louise. Do we have any questions in the Q&A? I don't think we have any questions at the moment. Does anyone want to raise a hand or have any questions?
Jill, I don't think so anyone has any questions unless
No.
you have anything specific to ask to the speakers just to start with, and or else we can conclude the session. I think there's one question. Hi, thank you. There is one question into the chat box.
Yeah, we've got a question from Karen. Karen's asking, how are clinics transitioning into COVID post-pandemic? Shall we pass that one to Victoria initially, or? Victoria?
Thanks, Jill. So I think, as I said, I mean, at this stage, we're keen for clinics to be making their own risk assessments in terms of how they see patients and things like that. But at this stage, we're also still encouraging all people to be testing if they have symptoms, and so we're still hoping to be counting COVID cases. So at this stage, we're still in COVID pandemic response. That may change over time, but it's still continuing that. I think that's, I don't know if that's what you're asking, or if it's more the nuts and bolts of what clinics should be doing and how they should be approaching it.
Thank you. Does anyone else have any questions? No, in that case, I'll just say thank you very much for attending. First of all, to our speakers, Dr. Victoria Mansell from ACT Public Health, and Amy Bowen from North Canberra Practice and Partnered Health, and also Dr. Louise Kenyon from who's the CHN Health Program, Health Pathways Program at Capital Health Network. So thank you very much to all our speakers. Thanks to everyone for attending tonight. And again, the recording will be available in a few days' time for anyone who wants to have a look again. And we hope you've gained some new knowledge and some ideas for your practice this evening. And if you have any further questions and that we didn't address tonight, or you'd like to ask anything else or get in touch, feel free to get in touch to CHN. You can see the primary care email address. Thank you very much.